Welcome back to all of you. Health disparities are defined as differences in health between groups due to a lot of variables. Variables like race and ethnicity, socioeconomic status, age, gender, or sexual orientation. And our COVID-19 experience is evidence of this, with some minority groups disproportionately impacted. So today we are happy to have Dr. Debbie Zimmerman, who is Essence Healthcare's Chief Medical Officer, along with their Clinical Program Director, Eric Alexander. Good morning to both of you.
Good morning. Thanks for having us.
Debbie, I want to start with you. How is Essence Healthcare addressing these possible health disparities?
Well, the first thing we did at Essence Healthcare is we made a formal commitment to understand and address the potential health disparities among our almost 64,000 Medicare Advantage members. The next thing we did was we actually convened a health equity task force. That task force was made up of wonderful individuals from our own organization, but we also brought in external experts. We brought in members, our own members of our health plan, a physician, participating physician, and mental health providers. Next thing we needed was information, right? How can we assess potential health disparities if we didn't have the information? And we're talking about information that's not readily available necessarily to a health plan. Just those things you mentioned. Things like, where you live, education, access to transportation. Or you live alone or do you have a caregiver? Not to mention things like race or ethnicity. Luckily, we have a wonderful analytics team that brought all this information together.
And once you got that information, what types of inequities did you find?
Well, some were a little surprising. As a matter of fact, we were a little surprised at what we didn't find. Access to care, for instance, was one of the things we looked for. Did we have high-risk populations where there were barriers to getting access to care? And we actually found no difference in access to primary care. We think this is a testament actually to Essence Healthcare's very close relationship with our practicing primary care physicians who are dedicated to providing great care for our membership. But we did find disparities. We found that high-risk populations were utilizing the emergency room for situations where they probably should have utilized their primary care physician, and they were having difficulty accessing and taking their medications for chronic conditions like diabetes and high blood pressure.
And Eric, I want to bring you into this conversation too. As we mentioned, health disparities are apparent in the COVID-19 infection and vaccination rates. So what is Essence Healthcare doing to address this?
Well, as it's been widely publicized since the beginning of the pandemic, communities of color have been particularly hard hit by the coronavirus pandemic. And according to the most recent CDC data, the gap between the number of cases between white Americans and particularly Black, Latino, and Native American communities have narrowed largely, but there's still large variations in hospitalizations. Communities of color, people of color are 3 to 4 times more likely to be hospitalized for coronavirus if they get it, and almost twice as likely to die. So those persist despite a narrowing of the overall case counts. So that begs the question, why? Obviously, there's a lot of data over the generations that have demonstrated that people of color have higher rates of chronic disease and obesity, which are risk factors for death and hospitalization for coronavirus, and also the social inequities, increased levels of poverty in communities of color, et cetera.
And the conversation could go on, and we are happy that Essence Healthcare is addressing those longstanding systemic health and social inequities. And for more information on Essence Healthcare's Medicare Advantage plans or the COVID-19 vaccine, call the number on your screen or visit essencehealthcare.com.